Well, getting back to a full life is an elusive concept for people who manage constant pain. That type of severe, never-ending agony can leave you debilitated both physically and emotionally. It's why a local doctor is really committed to helping patients using scientific solutions, along with a healthy dose of care and respect.
And Dr. Leon Margolin is the founder of Comprehensive Pain Management Institute of both Columbus and Cleveland, joining me today. And it is so good to have you on the show with us, Doctor.
Thank you for inviting me.
Let's talk about this problem first and foremost of chronic pain. Why is it that it is just so difficult to manage and really to find a long-term solution for?
Chronic pain, in a nutshell, becomes disease by itself. For example, you have arthritis, you have diabetes, you had surgery. In addition to your medical condition, your chronic pain is a disease and it needs to be managed.
And you mentioned that your program is multidisciplinary in that. So what exactly does that mean?
That means that we utilize techniques and treatments from more than one specialty. We also have consultants such as pain psychologists. We have pharmacology doctors. We consult about urine screens and consultants from other specialties.
And we know that some of these prescriptions are strong narcotics, right? So one of the biggest things that you advocate for is safety in giving that to patients while also providing them relief.
Recent statistics, unfortunately, shows that you have higher chance to die from opioid medications than from motor vehicle accidents. And we all invest a lot of resources and energy to find the safest vehicle we can drive. We go for courses. So we should invest some time and thinking about choosing the program that provides you with safety. We treat chronic pain patients. We use opioids only when necessary. We use safe doses. We monitor very tightly. And we provide it in a safe and efficient way.
And I want to listen to one of your patients as she shares how your care essentially changed her life.
I'm someone who has been in severe pain now for, let's see, 8 years. And during those 8 years, I've got some pain relief, but never a lot of pain relief. And I was starting to get pretty hopeless. When you get someone who respects you, who listens to you, and who tries things that nobody else bothered to try, things start looking up.
And just listening to that patient too, doctor, compassion is something that people who've had chronic pain their whole lives feel like they don't get a lot of. How important is that when you're treating a patient who's been struggling for so many years?
That's crucial because our mind and body is connected. You basically try to work together with the patient. You want to assign responsibilities to the patient. You want to explain benefits and risk. And if you don't like what you're doing, if you're not empathetic, the patient doesn't feel you care. It's a very tough job to do. So we're selective and we try to show as much compassion as we can.
And you work, as I mentioned in the beginning, through Columbus, through Cleveland, and you did get referrals from these major hospital systems pretty often, right?
That's accurate. We actually work with major hospitals because we take the responsibility of managing chronic pain patients, but we do the day-to-day management, keep patients safe, treating problems, referring them for evaluations if necessary. And I think it's a win-win approach.
You have won so many awards, so many accolades for your compassionate care for your patients.
Oh, thank you for your kind words. We like what we're doing. We have a great team, and we've been here for almost 10 years, and we keep growing and enjoying our program.
Your institute has also been rated, I want to mention, among the top programs in the state. You are focused on advancing your work as well through clinical research. So you are constantly learning, constantly educating in your field.
That's accurate. The field is developing, and we try to stay on top of it. We were lucky to cooperate with major hospitals. And I think it reinforces the clinical work. We like it to have good people and nice atmosphere, creative approach, and it works out well.
And if you are out there and you have been struggling, there is no need to continue that without reaching out and trying to get some help. You can find Dr. Margolin at cpmiohio.com. That's the website, the phone number also on screen. So, doctor, thank you so much for being with us today.
Thank you for inviting me.